Hello, friends. Mike Feeney here with the Union Labor Advisory Network. In today's episode, we're joined by Stephanie Campbell, Senior Manager for Medical Affairs with Hello Heart. With nearly 2 decades of experience in healthcare, Stephanie brings a powerful message about the importance of heart health, especially in our union labor communities. She breaks down how Hello Heart is helping union members take control of their health through simple, effective tools like blood pressure monitoring and an easy-to-use app. We also talked about women's heart health and how preventative care can change and save lives. Let's get into it. Hello, friends, and welcome to the Union Labor Advisory Network. I'm Mike Feeney. Today, I'm extremely proud and privileged to be with Stephanie Campbell, Senior Manager for Medical Affairs with Hello Heart, with us today to learn a little bit more about her background, history, and experience, and what's going on in the world of Hello Heart and how they're supporting union labor. So, Stephanie, thank you so much. I'm so happy to have you on with us today.
Mike, I am thrilled to be here. I'm privileged to be talking to you today. So thanks for having me.
Yes. And Steph, I know I see you all over the place. So you're traveling across the country, preaching the word of Hello Heart. But for the audience, can you just give us a little bit about background? I mean, I know you've been a nurse by trade, and what inspired you to make that leap into the tech space, the health tech space, and as your nursing journey, what that looked like so far. So.
Yeah, I love the question about how I got started in tech. I think when we think about nurses, we think about bedside nursing. And I started my career actually 20 years ago in the emergency room. The emergency room is so much fun. It's like those TV shows that you see, high adrenaline, super rewarding because you're able to make instant, you're able to really touch people's lives in a quite profound way and make those connections to help them in this really scary time. And I loved it, but I think after a while, it got to the point where I was a little disheartened. It's chronic disease management's tough. And I would see people come in, heart attack, stroke, shortness of breath, you name it, and really just know they had diabetes, high blood pressure, but they just couldn't get it under control, right? And I think that's a lot of Americans. So kind of propelled me out of the ER and eventually found my way to population health. And someone called me about Hello Heart. And at first I was like, I'm not interested. I'm not looking for a job. I was in actually helping seniors get to care. And what she told me about all the great work we were doing, all the studies that we've published. And I was instantly, I want to be a part of this organization. Let me in. I want to work for Hello Heart. So that's kind of how I got into this industry. And I have been grateful every day since.
Yeah, you work with large membership groups, union organizations that serve others. So, I mean, it seems like a perfect fit for you. One, your background, how you've been, you're built just as a human being. I mean, I know you do such charitable work and supporting others as well, which, again, I'm just so thankful to know what you do and how you're helping others. Can you give us a little overview about what Hello Heart is, the origins of the company, how it got started and where it is today?
Yeah, so Hello Heart got started about 12 years ago. Our founder and CEO, Mayan Cohen, had a loved one that was going through a major medical issue, and she quickly realized that there's so much information out there for individuals in as they're going through these life events that it gets overwhelming. So she created at the time Hello Doctor, and over the years it's grown into Hello Heart. So at first it was kind of housing all your medical information, and then we recognized pretty quickly that 1 in 2 US Americans working has high blood pressure, high cholesterol, or both, but it's 80% preventable through lifestyle and medication adherence. So we knew we wanted to get in this space and have transitioned over. People can manage their blood pressure, their cholesterol, their weight, their activity, their medications, get real coaching on ways to move more, eat healthier, all these things. And as a result, really, I think it's exciting to see where we are today with these major publications and peer-reviewed journals, medical journals, with 100,000 Hello Heart users that say we can drop blood pressure by 19 points systolic and cholesterol, LDL cholesterol by 67 points. So it's exciting to me because those are the two biggest risk factors for heart attack and stroke, and we're really making a difference here.
That's great. So could you give us a little overview as to in regards to how you're working with union labor? I know you go to all these particular conferences as well. Some of the value propositions that you really present to some labor officials. Again, there's they're always looking for better ways to support their members, reduce operating expenses as well, and utilize technology to provide those better services to the membership groups, because these members in labor, they're always traveling. They're not in, always in a physical space. So getting to a doctor is not always easy. Utilizing these tech resources always make that things so much better. So maybe you can elaborate a little bit on that for us.
Yeah. So what I forgot to mention about Hello Heart is that we are a fully digital solution. So there's an application that the user would download to help them track all these heart health metrics. And so when we look at labor unions and Taft-Hartley funds, we're really looking at individuals who are largely, moving a lot and maybe, busy during the day, those shift workers that we know are at risk cardiovascular wise due to potentially maybe eating a lot of processed foods or drinking energy drinks to stay awake. I mean, when I worked in the healthcare space and I was a shift worker, I'd wake up and I'd slam a Red Bull. So, I think you're looking at getting that caffeine in quickly. And so I think when we take a step back though and look at labor groups, there is a big need. We see that these guys are at risk for cardiovascular disease, and they're costing labor funds a significant amount in terms of medical costs, right? For not only for blood pressure, cholesterol, cardiovascular needs, also musculoskeletal. So I think, if you can leverage a platform that's digital in nature that helps users take control of their heart health or their chronic conditions to allow them on their time to better manage these and then share that back with their doctor. So to your point, maybe they're in a rural area and they can't get to care or they can't take time off to get to care. Our solution really allows people to take their blood pressure when they're ready, look at digital coaching when they're ready, really meeting them where they are to help them have those meaningful conversations with their clinicians when it matters most.
That's great stuff. And can you tell me, and I know it always comes down to financial, when you're looking at, we want to bring on a new service provider to support our benefit funds as well as members, some of the clinical or financial benefits, the ROI in implementing a service like this to union organizations or large Taft-Hartley funds as well.
Yeah, I think it's really important for funds to look at not only is this solution going to engage my population, but is it going to help me reduce medical costs, right? There's one that's, I want my people to have tools that they're going to use. Two, I want to see that it's actually working. I want you to make good on the promises that you've said that you're going to drop blood pressure and cholesterol and all these things. And lastly, and really importantly, help us control costs. I think across the board, I'm hearing that costs are going up. So, funds who partner with us, they're only paying for individuals who enroll and participate and are engaged in the program. I think that makes the most sense. And then looking at providing performance guarantees to say, hey, we guarantee that people will drop their blood pressure and that we will give you a 2-to-1 ROI. That's important for us to showcase to you. And it's not just us saying that that we have seen financial cost reduction. Clinical outcomes drive financial savings. So we have partnered with Validation Institute. They did a number of exercises where they looked at our data to see if we are saving money, like we say we're saving money. Both times about 17 and 19% cost savings after year one for those in the program. And then most recently, Aon, a large healthcare broker, did their own independent analysis. And I think what's exciting for that is they looked at about 1,600 Hello Heart users, and then they use their own proprietary algorithms to find digital twins. 3 people matched to one Hello Heart, 3 non-Hello Heart matched to one Hello Heart. And they found that we were able to save a really considerable amount. And I think that makes sense. Happy to send you that too. So if we want to show what that looks like. So it's not just us running these savings, it's healthcare brokers. And I think that's important as well, that it's not just us looking at it, it's other people vetting us.
Absolutely. And again, the data, it's the proof's in the data, right?
Yeah.
So like when you look at all those clinical reports, that you do this is the amount of money you're going to save. You walk 20, 50,000 steps. This is how much weight you're going to wind up losing.
Yeah.
And all these tech tools that are there are really helping to drive that particular engagement. And I think you mentioned one thing on just earlier too, is this is not a per member per month type. It's based on utilization of the service for these particular benefit funds. Is that correct? Did I hear you correctly in saying that?
Yeah, when we look at how we bill for the program, we partner with what we call easy buttons. So in some instances, a medical carrier or the pharmacy vendor, and then we can contract and bill through them potentially. So you don't have to, when you're talking with your fund leaders, you don't have to create a budget separately for this. It can just go through the health claims, which is nice. But the other part of it is we're only charging for those that 1, are eligible for the program, and 2, meet criteria, and then 3, that are actually joining, engaging. And I think that's really what fund managers want to see. They don't want to be charged for their whole population for a program, especially if it's not going to engage people.
Right. Yeah, because we're talking about just trying to reduce expenses and then drive that utilization. So it's not only on the benefit funds, but it's on the provider as well to help educate that population on these particular services, and it's how it's going to enhance their lives personally. Because again, costs. You want to make sure that everybody's healthy, regardless of costs. Unfortunately, the cost does drive an impact. But if you could help reduce that through technology, again, those are major factors. So
yeah, and I forgot to mention this. I think it's important too when we're doing these analyses of data to show a ROI to a fund. And really in the mini exercises that we've done, so we did this with Siegel as well, right? Siegel's a well-known labor healthcare broker. We're looking at health claims data. And what we typically see when we're looking at these health claims data that speak to the cost savings is people, because they're looking at their blood pressure regularly, they're getting ways to move more, eat healthier, manage stress, all these things. They're getting to their primary care more frequently, which is wild, 52% more than non-Hello Heart users when we look at the data. And then the reason that we're driving down these costs is because they require less hospitalizations. The Hello Heart individuals was just telling me they're more proactive in their care, less reactive. And we think about health needs, if you don't get gas and you don't have a gas gauge, how are you going to know that you might not break down on the side of the road? You got that gas gauge that alerts you, hey, you got to get gas. So we're kind of helping people drive to their doctor and engage faster, which is so exciting.
That's awesome stuff. So Steph, tell us a little bit more. What's on the horizon? What's on the future? For 2025, 2026 with Hello Heart. What's going on? I know again, technology always changes fastly, rapid pace. But as you're starting to build, your name, your brand across the union labor space, what are some of the innovations that are coming within the future?
Yeah. So, Hello Heart started really as a way to help people manage their health records, and then kind of grew into this blood pressure, cholesterol, weight, activity kind of tracker with digital coaching. And I'm excited to say that what's on the horizon for us for 2025 anyways, is we are investing and innovating in ways to help our population better manage their cardiovascular needs. And we had a client come to us and say, hey, we are trying to solve for hypertension in pregnancy. This is a need for us. We're seeing costs, we're seeing poor outcomes. And we were quickly able to adjust our solution to be able to meet that need. A client came to us and said that. So that tells me that we're always looking at how can we really enhance our product so that we're meeting the needs of individuals. I think for women in labor, if they're in the labor space, if they have hypertension and they become pregnant, that's a great way to turn that feature on. They can get digital coaching that's relevant and more sensitive to that really exciting time in their life. We'd already had a add-on for menopause for women. So as your estrogen level decreases, your risk of high blood pressure, high cholesterol, and irregular heartbeat go up. So having both of these kind of from pregnancy to menopause for women and really diving deeper into women's heart health makes sense for us in 2025. I will say in 2026, Hello Heart is going to be releasing a new piece of hardware called Pillbox by Hello Heart, and it's a beautiful blood medication case. And what it does is, it's about the size of a sunglass case. It lights up around it to tell you that your medications are due. There's a illuminated light that's white and it blinks. And then when you open it, you can see what day is blinking when you pick it up. It's Bluetooth and Wi-Fi enabled, so it automatically kicks it over to the application, logging your weight. Our blood pressure cuff is Bluetooth enabled, so when someone takes their blood pressure cuff, it pulls it over, and this will do the same for medications. And then we help kind of look at that data to surface to the user, hey, this is how your medication's helping you, because the stat is 50% of people who have high blood pressure medication, they're not taking their medications as prescribed. So that's only half. And then when we look at statin usage in those with high cholesterol, about 50% are on it after year one. So we know that there's a need for better medication adherence. Some people, because blood pressure and cholesterol are really silent in nature, there's no symptoms. You could have it for a long time and not really know the damage it's doing unless you're looking at those numbers regularly and really seeing how those medications impact. So those are the two things on the horizon for Hello Heart 2025 and 2026.
Okay. And any upcoming events that you want to share with our listeners that may be coming up?
Yeah, so I'm actually in Fort Lauderdale, Florida currently in a hotel because Hello Heart is having a Women's Health Leaders Summit, really, really diving deeper, looking at thought leadership with so many women leaders that are really dedicated and interested in driving down the stats for women with heart disease. Women die from heart disease more than all cancers combined. And it's heart disease for women is not sexy. So I'm excited to say that the upcoming event that I'm going to is tonight. And we've got really great speakers there coming to talk about women's health and how we can move the needle and really close the gap, because we see in data women wait on average 37 minutes to seek care when they're having a cardiovascular event. And Mike, what's crazy is that when I worked in the ER, I saw this a lot. Women would come in thinking they're just not feeling great, having heartburn or nausea, and they'd be having a heart attack. And so women wait because they don't always know their symptoms. Sometimes they go to the doctor dismisses it. So women die twice the rate of men after having a heart attack because of the fact that we delay care. It's not always well recognized. And we really need to close that gap. So exciting to see all these women coming together to talk about it more and how powerful.
It's crazy. It's just crazy to see how technology is evolving so fast. The world of AI and everything else that's happening, in the world and as well as in the labor space. But these technologies are really enhancing people's lives, reducing those expenses to the benefit funds, and providing better quality care to those members that are working so hard to support our country, the communities, their families. And again, just knowing your background and how now you've transitioned into the world of health tech, being that evangelist, talking about all these incredible programs and services. Again, I'm just so happy to have you as a sponsor and supporter, as well as a friend, just doing some incredible work across the country. And you're a ray of sunshine every time I see you. So you're always working so hard, but always with a smile on face, because I know you love helping people, as do I, and I'm just so thankful to know you and appreciate all your time today.
Yeah, thanks, Mike. I'm thrilled. I'm thrilled for ULA. I think you guys are doing great work. How important is it to really help youth even get connected to these great trades? And like you, I'm passionate about helping our tradespeople and these unions, one, have support, and to really how great the work they're doing, really shout that out from the rooftop. So thrilled to be with you today. I think you're a great friend. Love you and Stephanie. And yeah, thanks for having me. Means a lot.
Oh, absolutely, Steph. Yeah, I mean, what we hear, and as you look at labor is built to help others. And on multiple occasions, I talked about some of the charitable organizations. One that I know you belong to as well, my Rotary Club. That motto is service above self, and we're here to serve others, support that membership group so that they can enhance their lives, their careers. And we are both very fortunate to work in this particular space, to work with some really great labor officials that are working on behalf of working men and women in our communities, to be able to make sure that they have the best quality health care, and they're utilizing that health care through education and the resources that you're providing. So again, so thankful to have you on. I'm wishing you all the best. I'm looking forward to seeing you again. Hopefully, I wish I was in Florida, but I'm not in Florida today. But again, we'll get all the resources, any links that you have to some of the data and statistics on our full interview once we have everything edited and distributed. But again, I just want to thank you again for everything that you do, and proud to know you and work with you in our union labor space.
Thanks, Mike. Proud to know you too.
All right. Take care.
Thanks.
Best of luck. I'll talk to you soon.
Okay.
All right. I'd like to thank all our sponsors for helping to build and promote the ULA network. It is because of you that we're able to support, educate, and promote informative content relevant to labor. Please subscribe, like, and share our channel and media. I'd like to thank you all for your support.